Thank you, Professor Imtiaz Ahmed, for your valuable presentation. This is very, very important for this COVID situation. And the data you have presented and all the information, that is quite amazing. Like, it is difficult to collect all this information, and you have presented so nicely. Thank you so much. I would like to do the question and answer session after all our presentation is done. And then we can, if you have questions, please keep that with you. And when we finish our presentation, you can let us know which question and who you are going to ask. Would that be okay? So I would like to start asking Professor Miwako Hosoda, who is the second speaker. And her topic is vaccine inequality and human rights in the era of COVID-19 and beyond. And I would like to introduce you, Professor Miwako, here with a short of the introduction. Professor Miwako is a professor of CISA University in Japan, and she graduated from the Department of Sociology in Tokyo University and did a master's and PhD from the Tokyo University as well. She studied at Columbia University and Harvard University of Public Health. She is the vice president of the Asia Pacific Sociological Association, and she was our former president of this association, last one. And she is also the president of East Asia Sociological Association. And RN, she was also elected to be the board of the International Sociological Association, RC 15, Sociology of Health in 2010, and to the position of president in 2018. I hand over to Miwako, and over to you, Miwako, for your presentation.
Zakia, thank you very much for your introduction. So today I'd like to talk about the vaccine inequality and human rights in the era of COVID-19 and beyond. Please change the next slide. Next one, please. Thank you. So in the COVID-19 situation, no one is safe unless everybody is safe has become a common understanding. Until the development of the vaccine, prevention of COVID-19 infection was limited to preventive behaviors such as social distancing, hand washing, mask wearing, and urban lockdown, as well as symptomatic relief for infected individuals. Next slide, please. Eventually, vaccine was developed and prevention became possible. According to the WHO, vaccination is one of the most inexpensive interventions against infectious disease and is characterized by the fact that the target population can be set in advance and no lifestyle change are required. On the other hand, there are various problems that need to be considered, such as the side effect of vaccine, the availability of vaccine, and the fairness of access. You can see the two major issues related to vaccines. There are the issue of fairness in vaccine distribution in the global world, and the issue of mandatory vaccination versus individual freedom. In this presentation, I'd like to raise these controversial issues to vaccine equality and human rights in the era of COVID-19 and discuss this topic with participants. Next slide, please. In terms of the vaccine equality, there are COVAX. This is an international framework for high and middle income countries to jointly purchase COVID-19 vaccine and distribute them free and charge to developing countries. It is led by WHO in cooperation with the Gavi Vaccine Alliance, an international organization that promotes the spread of vaccine in developing countries, and the Coalition for Epidemic Preparedness Innovations, CEPI. More than 180 countries and regions are participating in this framework. Next slide, please. So I'd like to share the COVAX framework. The Can you please use the video if possible? So if it's not, okay, so there are some video I like to explain COVAX. So please visit the website of WHO COVAX frame. So next slide, please. The COVAX framework and other measures have improved vaccine coverage worldwide. This is a world map of vaccination as of October 2nd, 2021. More than 6.3 billion doses have been administered, enough to fully vaccinate 41% of global population. Please see the area colored green, where 60% and up population are already vaccinated the first dose. At the mid-October 2021, 55% of Asia people had been injected with at least one dose, while 39% had received second one. The vaccination rate for COVID-19 in Japan, for example, is 78% for the first dose and 74% for second dose. Next slide, please. As the COVID-19 vaccine became more available, some governments required their people to be vaccinated. Then another problem has arose. Many of civil groups around the world are opposed to vaccine mandatory and vaccine passport because of many reasons. Next slide, please. Some of the reasons are considered to be vaccine myth. So many government and medical institutions are scrambling to make people know the myth and realities about vaccine. Medicine has both sides of science and art. Sometimes the view of experts can be uncertain. It is also necessary to endure uncertainty. Can we withstand the medical uncertainty? Each individual should make independent judgment by referring to expert-owned, obtain health literacy and media literacy. Next slide, please. In the US and Singapore vaccine record, such a vaccine passport are now required to be presented not only the airport, but also the restaurant, shopping centers, and many other places. At such time, people who cannot be vaccinated for health reasons or who have psychological fear about vaccines may be excluded and discriminated against. From the perspective of equality and human rights, we will need to avoid this kind of discrimination. Next slide, please. People who avoid vaccination for various reasons, including concern about adverse reaction, are worried. Against the backdrop of the nationwide problem of vaccine harassment, in which people are treated unfairly in the workplace because they have not been vaccinated. Some people are saying that the right not to be vaccinated should be understood. In order to prevent infection, it is important for those around us to deepen our understanding of each individual situation. We do not force people who do not want to be vaccinated to get vaccinated. Vaccination is not given without the consent of the person receiving it. So it is necessary to force people at work or around. It is unnecessary to force people at work or around them to be vaccinated or to discriminate against them. A vaccine is not the only solution to the COVID-19 crisis, we should know, but a combined effort is still needed, including preventive action by people and improvement of the usual healthcare system. To achieve this, international collaboration and solidarity are necessary. So I'd like to talk with all participants how is the better way to overcome this pandemic crisis for currently and in the future. Thank you for your attention.